Going from Ozempic, Wegovy to Mounjaro. How do we do this switch? This has probably been one of the biggest questions that I've been getting since Mounjaro is now available here in Canada and Ozempic continues to be on back order and very challenging to get. So this video is really for both individuals that are using the medications and clinicians on how we go about switching between the various other GLP-1 medications to Mounjaro. Now, to clear up some confusion, because if I'm confused, I can guarantee that you are confused as well. There's a lot of different medications that are coming to market, a lot of different names, and so I just want to kind of clear it all up as to which one we're talking about and what is going on with this, that, and the other thing. So what I tried to do here is kind of create a lovely little table here so that it'll hopefully be as clear as possible. Hopefully this will be blown up enough that you can actually see it. But as you can see here, what I have is the three main molecules that are on the market that are being used as GLP-1, and in the case of tirzepatide, a GLP-1 and GIP receptor agonist. And what I've tried to do here is in this far column, we have the actual molecule, the generic name of the drug, then we have the brand name, then I have the indication, and the dosages are in the last column closest to me. So first up, we have in the teal at the top there, which is tirzepatide, the newest guy to the market. That is the GLP-1 GIP receptor agonist. There are two names that it's currently falling under, Mounjaro and Zepbound, which was just recently approved by the FDA. Now, the difference between Mounjaro and Zepbound is that Mounjaro is only approved and indicated for type 2 diabetes management, and Zepbound is approved and indicated only for obesity management. Now, yes, someone could be prescribed these medications off-label. However, it's going to come down to your drug insurance provider and whether they will provide coverage for that said medication. Now, when it comes to Zepbound or Mounjaro, it's pretty straightforward. Both of them come in dosages of 2.5 up to 15 milligrams once per week, and there is no differences whether you're on it for diabetes or for obesity management. Next up, we have got the orange, which is semaglutide. Semaglutide is found in Ozempic and Wegovy. Again, the difference between them is that Ozempic is used up to a dose or a max dose of 2 milligrams once per week for diabetes management only, whereas Wegovy is used up to a maximum dose of 2.4 milligrams once per week for obesity management. So there is slight differences not only in the pens but also in the dosages. Now, technically, Rybelsus, which is also on the market, contains semaglutide. The difference being is that Rybelsus is an oral tablet. It's a once daily tablet. You take it every single day on an empty stomach. It is only currently indicated for diabetes management at up to a maximum dose of 14 milligrams once per day. And then finally at the bottom here we have liraglutide, which is in the green. We have Victoza and Saxenda. Again, Victoza is a max dose of 1.8 milligrams once per day, only used for diabetes management. And Saxenda is up to a max dose of 3 milligrams once per day, only used for obesity management. All right. Everybody clear on that? Does that make sense? Clear up all the confusion? Hopefully it does. If you hear a bunch of different names and such like that, I mean, I don't blame you. They keep remarketing it under different names, and I think maybe there was even a article or something that just came out recently that says they're going to maybe put some legislation forward to limit that because it's getting very confusing and very hard to figure out what exactly is going on where. All right, now let's get into the meat of it of how we actually switch from these various medications over to Mounjaro. And just a quick disclaimer, if you are using these medications, please make sure you're following up with your care team and getting the advice for you as an individual, because this is not medical advice. This is purely for educational purposes only. And of course, as an aside, if you're getting some value out of this video, don't forget to hit that subscribe button down below as well. Check me out on my other channels at The Official Dr. Dan, and check out my Amazon links down below where I do receive a commission, but I've recommended a number of products that can help you along your weight management journey. Now, the process of switching between these various medications is actually pretty straightforward for the most part. Our main goal is to see what amount of effectiveness that we can maintain for an individual that's already on a different drug but also preventing any kind of side effects or trying to limit the development of side effects to the least amount possible. So the first method for switching from, say, Ozempic, Wegovy, or Saxenda over to Mounjaro or Zepbound is really just to go from whatever dose of the other medication that you're on and just switch to the very starting dose of Mounjaro or Zepbound, which is 2.5 milligrams once per week. That's going to be the easiest, that's going to be the safest, and then once you're on the Mounjaro, you do 2.5 milligrams once per week for 4 weeks, then you go up to 5 milligrams and so on, and ultimately find the dose that's going to work best for you. Now, maybe you've been on Ozempic or Saxenda for some time now, you're at the top dose, or maybe you're working your way up there, or maybe you're on just some other random dose, and you don't want to go all the way back to the starting dose with Zepbound or Mounjaro. So what we would maybe do in that case is really looking at what dose exactly are you on. So as an example, if you are on, say, Ozempic or Wegovy, and you're on a dose that's less than 1 milligram once per week, I would still recommend going back down to that 2.5 milligram once per week of Mounjaro or Zepbound. The reason being is that Mounjaro and Zepbound, they are effective and they are definitely more potent. And when we look at dosages of, say, 1 milligram once per week of Ozempic, it's only starting to kind of get somewhat similarities with the Zepbound Mounjaro 5 milligrams once per week. So to be better safe than sorry, I guess you could say, we should definitely bring that dose down to the 2.5 milligrams of Mounjaro, Zepbound. Start there and work your way up. So again, that's for Ozempic, Wegovy dosages of less than 1 milligram once per week. What you want to do is start at that beginning dose of the Zepbound Mounjaro. When it comes to Saxenda or Victoza, regardless of the dose that you're on, even if you're at, say, 3 milligrams once per day of Saxenda, I'm still recommending going back down to the starting dose of Zepbound or Mounjaro of the 2.5 milligrams once per week, just because most of the data really shows that Saxenda isn't nearly as potent, and I would much rather you, again, not have any side effects. Now, for those of you that are on Ozempic or Wegovy 1 milligram once per week, you could probably pretty safely get onto Mounjaro 5 milligrams once per week and start there as your beginning dosage. Based on the studies, in particular from the SURPASS-2 trial, when we looked at individuals that had type 2 diabetes using both medications, the side effect profile between Ozempic 1 milligram and Mounjaro 5 milligram were pretty similar. Similarly, we saw similar effects. So it's likely going to be that if you tolerate Ozempic 1 milligram, you're probably going to do okay on Mounjaro 5 milligram once per week. For everyone else that's on a dose greater than 1 milligram once per week of Ozempic or Wegovy, I'm still making the recommendation that we start out at 5 milligrams once per week of Mounjaro or Zepbound, not really going any higher than that. Some people might say, well, I'd like to start at, say, 7.5 milligrams of Zepbound or Mounjaro. But again, I would like to take it and be a lot more slow and safe versus having you develop a whole pile of side effects and not have a very good time. And that's even if you're on Ozempic or Wegovy 2 milligrams or 2.4 milligrams once per week. Again, better to be safe than sorry. So hopefully that gives you a bit of a breakdown of going from one of the other drugs, Ozempic, Wegovy, Saxenda, or what have you, switching over to the Mounjaro Zepbound, gives you kind of the dosage per dosage kind of comparison. In terms of when you would then start the Mounjaro in relation to these other guys, basically what you're going to do is whatever is your next dosing day, you would just start your Mounjaro or Zepbound on that day that you were supposed to do your regular dose of, say, Saxenda or Wegovy. As an example, if you dose every Friday and you did your last dose of Ozempic last week and this Friday's coming up, whatever dose you've worked out with your primary care clinician as to what you're going to start with, Mounjaro or Zepbound, you would then just do that dose this coming Friday. Alternatively, if you're on, say, Saxenda once daily, you would just then start the Mounjaro or Zepbound on the next day when you're going to do your dose. So you did a dose yesterday, your last dose of Saxenda. Today you would just start the Mounjaro or Zepbound. Now, a couple of final considerations for you is that with Mounjaro and Zepbound, and really any of these medications, what we're finding is that they're so good at what they do that you don't necessarily need to push the dose to that maximum dose that you can get it to. So Mounjaro, Zepbound can go up to 15 milligrams once per week, but if you can't tolerate higher doses, you don't have to go up to that higher dose. You can still get really great effects at 5, 7.5, 10, what have you. Whatever dose ultimately is going to work for you is the dose that is going to be your dose. And so we work with that. We want to get the most efficacious response we can, but not cause you any side effects. That's really what the goal here is to do. And of course, if you are getting side effects, please continue to follow up with your care team. We do not want you having side effects and developing worsening and really bad, horrible side effects or anything like that, because ultimately the weight loss is just not worth it. So please remember that your health is ultimately what is most important. These medications, like I said, are effective at what they do, but the weight loss and losing weight is not the end all be all. We need to focus on the bigger picture of what losing weight or managing your weight is ultimately going to do for you in helping you to live your happiest and healthiest life. And of course, please remember that these medications are, for many people, I would say 99% of them, for life, in that they help you to lose weight, and that if you take them away, you are likely going to gain the weight back. And that's because losing weight is a risky business. There is definitely a risk that you could lose it and gain it back, but obesity and weight management, it's a chronic disease. It is a lot of factors and things that are largely out of your control, and ultimately you could be doing all of the right things and still be gaining weight. So please keep that in mind, that these are medications used for medical conditions and they are lifelong tools. Okay, that is it, and that is all, you beautiful people. I hope that provides you a little bit of insight into how you might go from Ozempic, Wegovy, Saxenda, Victoza, and all the others, and switch yourself over to Mounjaro or Zepbound. Really, it's pretty straightforward, and you just want to do it in a safe, effective, and slow manner. So until next week, everybody, don't forget to hit that subscribe button down below. And of course, check me out on my other channels at The Official Dr. Dan. And of course, check out my Amazon links down below where, yes, I do receive a commission, but I have tried to recommend some of the best products that I recommend for my patients in helping them to manage their weight journey and potential side effects that might arise initially with these GLP-1 medications. And of course, if you are in the Alberta, Canada area, please feel free to pop by our pharmacy, Apothecary Pharmacy, to check us out and see what we got going on there. And you can book yourself in for a consultation with myself. All right, and until next time, please always remember that small tweaks lead to massive peaks.